Welcome back. In the first 3 videos, we talked about how to identify people who should be tested for latent TB, how to interpret test results and make a diagnosis, and then how to initiate therapy with isoniazid. In this session, we'll talk about follow-up and monitoring for people while they're being treated, so you can support safe and effective therapy throughout their course. Now, the pathway that we've been using is deliberately designed to select people who are at lower risk of significant side effects, particularly hepatitis. Even so, adverse effects do happen during treatment, and ongoing monitoring is important for early intervention. Isoniazid therapy also continues on for 6 months, and so follow-up is key to encouraging people towards successful completion. My usual approach is to see people a month after starting to check on their progress and any issues, and then if there are no problems, see them again at 3 and 6 months after starting. This provides a few planned opportunities to review how things are going and to provide more medication when needed. People need to know, though, that if they do have significant problems, they should make contact sooner rather than waiting for the next appointment. When they do come for review, there are some standard things that I want to ask about every time. I start by asking them generally about how things are going, and then focus on medication adherence and side effects. With adherence, I ask about the timing of when they're taking tablets, as the ideal is to take them on an empty stomach, usually before breakfast. Missed doses are important, and I remind people that 6 months is 180 doses, so missing tablets will mean lengthening the duration of therapy until they complete. With side effects, again, I generally start by asking in an open-ended way about whether there are any issues, and then asking specifically about peripheral neuropathy and for abdominal pain and nausea to check for any symptoms consistent with hepatitis. Finally, as well as identifying any issues, I want to check for any barriers to continuing. Making sure they have enough tablets is obvious, but also asking about any other challenges in life that are disrupting therapy and encouraging them to press on. When it comes to side effects commonly seen in people on isoniazid, most are relatively mild, and people can be supported through treatment. We need to take any side effects seriously, though, as even minor issues can lead people to stop treatment if they don't get the support that they need. Younger patients can get flares of acne, which can be managed with the usual range of topical treatments, and reassurance that acne will resolve after the isoniazid is finished. Non-specific rash or itch is more common in older people, but if it's interrupting sleep or it's otherwise disruptive, an oral antihistamine can be helpful for a short period. CNS side effects are quite variable, and we found that around 10% of people complain of mild tiredness, and another 10% complain of some sleep disturbance, so there's no consistent experience there. I've found it useful to try varying the timing of doses, so for example, taking the medication at night instead of the morning if a person feels that they are tired during the day. Anecdotally, sometimes increasing the dose of vitamin B6 to 50 milligrams can be helpful as well. Other side effects like nausea, which are not too severe, can be managed symptomatically. Now, of the side effects, the most important to be aware of is hepatitis. The risk of asymptomatic but severe hepatitis in this selected group is low, and so I don't routinely do repeat liver function tests after they've had a normal baseline. In fact, there's evidence that treatment can be stopped unnecessarily because of mild fluctuations in liver function, and so it's best not to do them unless there are symptoms. If people do have symptoms consistent with hepatitis, they should be told to cease their medication and come for review and repeat testing at that time. While most side effects are manageable, there are some times when treatment should be discontinued. People with an ALT or AST of more than 150 should have treatment stopped, and liver function tests monitored until they come back to normal, which can take a number of weeks sometimes. Vague symptoms like pins and needles can be monitored clinically with increased vitamin B6, but if there's any established peripheral neuropathy that develops on treatment, they should stop. Ultimately, of course, individuals will interpret and experience side effects differently, and a small number of people may choose to discontinue therapy for a variety of reasons. If treatment is discontinued because of side effects, it's appropriate to refer your patient on for specialist review, as they can consider either another supervised attempt or an alternative treatment where appropriate. Finally, 6 months is quite a long time to be taking medication, And there are a range of things that can happen during that time which might raise questions. Here are some common points that come up. With regard to pregnancy, isoniazid is regularly used in the treatment of both active and latent TB. And there are no issues with fetal toxicity, although there may be some increased risk of hepatitis. For people who need to start or increase immune-suppressing medication, once people have been established on isoniazid, there shouldn't be a higher risk of TB reactivation. I'll normally say that if changing immunosuppression is required, it can be done after the person has had at least 4 weeks of isoniazid. For patients who work in healthcare or similar settings, it's also important to reinforce that latent TB infection is not transmissible, and they can continue with placements or work while they're having latent TB treatment. Most common of all is perhaps overseas travel. There are no barriers to travel with latent TB, although I do encourage people to avoid travel early on, as you want to make sure that treatment is being well tolerated first, and then provide them with a summary letter for travel in case any issues come up while they're away. The bottom line is that all of these scenarios can be managed, and they don't mean needing to interrupt or stop therapy. But if these or other unexpected things happen during treatment, you should feel free to make contact with a local TB specialist and discuss it. Okay, so that's our approach to monitoring during latent TB therapy. In our next and last video, we'll look at the final step of completing therapy. See you then.